Welcome to QD Clinic. QD Clinic is lessons from the clinic, and this month we're featuring QD clinics called Still's Disease or Not. I'm going to present a number of cases to you this month where we're going to figure out together whether the patient has Still's disease or not, or maybe some other autoinflammatory or periodic fever condition. Our first case today is a 26-year-old male of mixed Caucasian and Asian ancestry who presents with fever. Actually, he presented with arthritis and then fever. He has no past medical history. This was back in March of 2009. He had pain and swelling in his wrists. This was followed 2 weeks later by a rash on his abdomen, back, and arms. He went to his primary care. The rash was a little bit itchy. The primary care thought allergic reaction, gave him a Medrol dose pack and some Motrin. The rash ultimately got better, but the wrist pain persisted and then spread. A week later, he had a fever of 103. Those fevers came daily, usually around 9 to 10 p.m. They'd last about an hour. He'd have nausea, vomiting, and chills and sweats. Labs showed that he had mildly elevated LFTs and a creatinine of 3.3, presumably because he was taking a lot of ibuprofen. But he also had some proteinuria. So going forward, he had fever 2 to 3 times a day, like 9 in the morning. You always 9 p.m., but sometimes 9 in the morning or 5 p.m. Again, chills and sweats would ensue. A renal biopsy was done while he was in the hospital, and that showed mild interstitial nephritis with IgG deposition. His creatinine dropped down from 3.3 to 1.8 and later down to 1.0. He had ID consults and imaging tests in the hospital. Blood cultures were negative, and he was discharged with a diagnosis of maybe Still's disease. He was treated with steroids. 6 months later, he complained of shortness of breath and fever again, despite the prednisone 20 milligrams a day. The fevers were high. He had nausea and vomiting. He was found to have pneumonia. He underwent imaging. He had fibroscopic bronchoscopy. Biopsy showed non-specific inflammation. In the hospital, his creatinine was 1, albumin 3.8. LFTs were normal. He was anemic with a hemoglobin of 9.8, a white count of 11.9. His SED rate was 106, platelets 415,000. The ferritin was 9,800. He was seronegative for ANA, rheumatoid factor, and CCP. The CRP was almost 16, and UA showed trace protein. So he was discharged on prednisone 40 milligrams a day, and then given Kineret or anakinra 100 milligrams a day subcutaneously. He had great improvement in his fever, but still felt periodically odd, periodically felt like he was going to get a fever. He didn't. He started having injection site reactions when he started the Kineret. Those went away after about a month. He continued with wrist pain and joint pain and swelling in his hands and knees and feet. The labs were about as bad as I've just showed you. Again, he had some mild LFTs. So the question is, what does he have? I guess I didn't play up enough that he had chronic polyarthritis. At one point, I think he had 20 tender and 15 swollen joints. So did he have Still's disease or not? Against the diagnosis was the fact there was no serositis, no pericarditis, no pleuritis, no organomegaly, no lymphadenopathy, just some modest LFT elevations. Also, his fevers were odd. He had fevers in the morning, 9 a.m. That's kind of atypical for Still's disease. They weren't classically quotidian, meaning Q24 hours almost to the minute. Not really. And his fevers were usually 102 to 103, never reached 104. Now, 102 is good enough for a Still's fever, but 104 makes you feel better. And he had this proteinuria. Now, was that the result of his nonsteroidal-induced interstitial nephritis damage? Unknown. With time, that ultimately went away. But when I saw him, those were my questions. Now, in favor of the diagnosis was the spiking, unpredictable fevers. We gave him points for that. A rash that came and went. Gave him points for that. We gave him points for polyarthritis, a prodromal sore throat, high white count, high SED rate, high CRP, high ferritin, and increased LFTs and being seronegative. That said, he met Cush criteria and had 10 points. If you go to stillsnow.com, use the diagnosis calculator, you can figure this out by just putting it in yourself. He also met Yamaguchi criteria with 7 points. That was greater than 5 points and had more than 2 major criteria. But the question in him was, what about the renal? Over time, he behaved like Stills. He had a partial response to Kineret. He had a great response to methotrexate and tocilizumab, but ultimately he needed methotrexate and leflunomide as DMARDs along with tocilizumab, 8 milligrams per kilogram to control the arthritis and the systemic manifestations of disease. 6 years later, actually reading this gentleman's notes, lots of insurance issues. Denials, letters, it's just a horror what patients have to go through to get medicines. 6 years later, while off of tocilizumab because of an insurance issue, he started losing weight. His fevers went to 103.8. He had chills and sweats, cough, chest pain, pneumonic infiltrates. He had leukopenia, thrombocytopenia, very high LFT elevations, and a ferritin that was greater than 10,000. We tried to treat him as an outpatient by giving him a JAK inhibitor and high-dose prednisone, and then we had to hold his methotrexate because of the LFTs, and within a few days he's in the hospital and diagnosed with macrophage activation syndrome due to his Still's disease, probably prompted by the insurance company withdrawal of the tocilizumab. Again, he was very anemic. His white count was 2.2. His hemoglobin went down to 8. His aldolase was 26. His ALT was 930. His AST was 621. His creatinine was only 0.9. So he was managed inpatient with steroids and cyclosporin. Couldn't afford the cyclosporin as an outpatient. Was discharged as an outpatient. I gave him tofacitinib samples to hold him over. And he did very, very well going forward. Go forward almost 10 years, he's largely being managed with just methotrexate. Really seldom has a rash, never has a fever anymore, but he's just on methotrexate and doing well. So he's settled down into the chronic arthritis. Still's disease or not, yes, he had Still's disease. And it was rip-roaring, wild systemic disease in the first few years. Now, almost 10 years later, he only has articular disease, and it's bad, rheumatoid-like polyarthritis, but well-controlled. Now with just methotrexate, but he did need methotrexate, leflunomide, tofacitinib, prednisone, Kineret, and then ultimately the tocilizumab. Yes, it was Still's disease. Tune in for another QD, was it Still's disease or not, next.